Psychological disorders are equally as common as physiological disorders, yet these patients are often ostracized by society, sometimes being told it's all in their heads, which is completely inappropriate. Therefore, we're going to take a closer look at understanding psychological disorders. I'm Sarah Tippett, and welcome to this MCAT Science Review video. We'll first focus on an overview of disorders, followed by a comparison of the biomedical and biopsychosocial approaches, and we'll wrap things up with a review of the DSM. After a review of this content, you'll be able to identify the different approaches to psychological disorders, with the goal of being able to answer MCAT-style questions such as the one displayed here. You'll need to know several definitions for test day, the first being physiological disorders. Physiological disorders are defined by biology. This is a traditional definition of disease. Something is wrong with your body and therefore you're sick, such as in the case of cancer. Psychological disorders do not fit nicely into this definition since we can't always pinpoint a physical problem within the patient's body. There's not an infection, it's not related to their high blood pressure, and it's not a result of their kidneys not functioning. Currently, we define psychological disorders as clusters of symptoms rather than a specific bodily issue. A key aspect to psychological disorders is their impact on a patient's life. Most of us could say that we've had instances of feeling depressed or strange thoughts going through our heads. However, it is when these thoughts and feelings impact our normal lifestyle that they become a disorder, such as in the case of depression. Physiological disorders fit nicely into the biomedical approach. This theory places greatest emphasis on the physical aspects of disease, such as genetics and neurophysiology. Based on this, we use medication to fix whatever we feel is the problem with our patient. Blood pressure is too high, we give them a medication to lower their blood pressure. Serotonin levels are too low, leading to depression, we give them an SSRI to raise their levels of serotonin. One of the drawbacks to this approach is the focus on the reduction of symptoms rather than on the restoration of function. You see this frequently in cancer patients. We give them powerful drugs to combat the cancer in their body, but in turn reduce their quality of life to a point where some patients question if the treatment is truly worth the cure. The biopsychosocial approach broadens the physiological approach to include the environment and lifestyle of the patient beyond the physical and chemical problems in the body. External stressors play a role in disease and are considered. A patient's thoughts, emotions, and behaviors, as well as their surroundings, perceived class in society, and whether they suffer from discrimination or stigmatization are all considered. This method is often used when treating psychological diseases. For instance, when we look at a broad-spectrum approach to treating depression, we may include a medication, but we can also recommend cognitive behavioral therapy, exercise, and diet changes to help our patients recover. The Diagnostic and Statistical Manual of Mental Disorders, or DSM for short, is the Bible of psychological disorders. This text contains descriptions of symptoms of psychological disorders and is used as a diagnostic tool. It does not, however, contain information on the causes or treatments of psychological disorders. We're currently on version 5, and you'll see it abbreviated as DSM-5. The text is periodically updated in order to stay current. Let's finish up with an MCAT-style question based on the information we just detailed. The correct answer is D. Because the physician is prescribing only a medication and not taking into account all the other factors affecting this patient's disease, like her social environment and lifestyle, this would be an example of the biomedical approach. Let's quickly run through the main ideas you'll need to know cold for test day. Psychological disorders differ from physiological disorders in that they are the outcomes of thoughts, feelings, and emotions that result in a disruption of the patient's normal function. The biomedical approach focuses on finding a cause and treating the physical problem in the body with medication, whereas the biopsychosocial approach incorporates the patient's environment and lifestyle into the diagnosis and treatment plan. Finally, the DSM-5 is a diagnostic tool providing descriptions of psychological symptoms and classifications of disorders. Great job on getting through this video. You should now feel more comfortable when faced with MCAT-style questions dealing with psychological disorders. Keep up the great work!